Wonderful to see you, Speaker Pelosi.
My pleasure, Ady, always to be with you. And also a treat to get a chance to see your beautiful family.
Hey, so nice to see
Hello.
you. Thank you for doing this.
Hi, Carl.
Thank you for your tremendous leadership.
Speaker Pelosi, thank you so much for taking the time to speak with me today. The last time we saw each other in person was in 2019, when you allowed me to testify at the first ever congressional hearing on Medicare for All. It's been a dramatic and tragic 2 years since then. Amidst the horror of the pandemic, the American people rose up to defeat a fascist president who threatened us all. And this year, with an extremely thin majority, you have shepherded a transformative agenda through the House. The American Rescue Plan was enacted into law, but you have also passed legislation to rejuvenate our democracy, to empower workers, to give immigrants a path to citizenship, to get dangerous weapons off our streets, and so much more. It has been a tour de force. But these popular and crucial bills are being blocked by Republicans in the Senate. And Democrats have not yet marshaled the political will to get rid of the filibuster. So my first question is a how question. How do you do it? You are the most effective and powerful speaker in at least 60 years. How are you able to navigate the competing interests and ideologies of House Democrats, and convince even centrist Democrats to support these bold bills, in a way that hasn't yet happened in the Senate?
Well, thank you for your kind words and recognition of our House Democratic agenda. I also want to give credit to you and so many others, because our inside maneuvering would just go so far. It's the outside mobilization. You're a hero to all of us, and so many people follow your lead. And they weigh in with our members and make it easier for them to have the courage to take the votes. But let us salute always our VIPs, our very important people, our volunteers in politics, who get out there with the American people to make the case with the Congress of the United States. And we just can't give up in terms of the other body. We have to talk about the issues that we want them to pass. If we talk about Senate rules, it doesn't really relate to them as much as issues that are their kitchen table concerns. I'm not giving up on any of it. I'm not giving up on any of it.
Madam Speaker, in America we do not have universal health care, but we do have Medicare, which provides health insurance for senior citizens and disabled people. A glaring hole in Medicare, however, is that it does not cover care for our eyes, teeth, or ears. This is incomprehensible to me, because senior citizens are exactly the people who most need this health care. A broad coalition of 156 Democrats in the House, which is over 70% of your caucus, have publicly announced their support for strengthening Medicare to cover this care. Voters expect Democrats to deliver on health care, and this would clearly be a great policy and a smart move politically heading into the midterms. So, Speaker Pelosi, can we count on you to schedule a vote in this Congress to strengthen Medicare to include coverage for vision, dental, and hearing care?
We already did that, as you know, Ady, last year in H.R. 3. The lowering of prescription drug prices and the money that we save by doing that is essential to our expanding the benefits of Medicare. And that was what H.R. 3 was, which we passed last summer. There's every reason in the world for Republicans to join us to pass this bill. Even the president has supported these key provisions. And now we're in those kinds of conversations. We have to get, though, the House and the Senate to both pass the equivalent of H.R. 3, which enables the Secretary of Health and Human Services to negotiate for lower prescription drug prices. The savings, which are in the hundreds of billions of dollars, would then enable us to deal with dental, hearing, and visual benefits. There are other things, depending on how much money is saved, that we might want to also include in that, but we have to take that first step in order to get that done. And I'm optimistic that we will. Of course, it's easy in the House, but in the Senate, I think they're making some progress and coming closer to the negotiated benefit. They didn't have that in their bill before, but now they're fighting for that. And as long as they can get all the Democrats on board, then we can proceed with expanded benefits, for sure.
Thank you. Separately from strengthening Medicare, President Biden campaigned on a promise to lower the Medicare eligibility age to 60, which would cover another 23 million people. This expansion could be paid for easily in different ways. One of the options would be to empower Medicare to negotiate drug prices just as the Department of Veterans Affairs does, which pays half as much for drugs as Medicare. I know that you pride yourself on representing your caucus, especially when there is broad consensus like this. So, will you also bring forward the bill to lower the Medicare eligibility age?
Well, the money that you discussed about giving the secretary the ability to negotiate is the money that we were spending on hearing, vision, and dental. Now, should there be more money, then we can take it to the next step. But the president is looking at the budget to see how that is. We have $400 billion for home care for our seniors, for people with disabilities, a very top priority for us that we want to protect. If we're using the money for renegotiating prices for expanded benefits, let's get as much money out of that as possible. The way we're writing the laws, pharmaceutical companies cannot increase the price of prescription drugs higher than inflation. If they do, they have to give a rebate to the federal government of that amount of money. That's another pot we can put our hand in for increased benefits for Medicare, including lowering the age as well as hearing, visual, hearing, and dental.
But the richest people in America have gotten so wealthy this past decade. Surely we can find the money to lower the age, don't you agree?
Well, I do think that's one of the challenges that the president has. Of course, he doesn't have that problem in the House. We'll see how he does in the Senate. In terms of increasing the money coming into the federal government, it's not just only unfairness, as it has always been. It's now to the point of immorality that, especially during a time of pandemic, that the rich have gotten so much richer, and those who have been economically challenged, that challenge is intensified.
I very much hope that you will bring this bill up for a vote. He made it a campaign promise. And you control the House floor agenda, and your caucus clearly wants to lower the eligibility age. It will help us win the midterms.